Does seed cycling really works? So let's see what it is and what scientific evidence says. Seed cycling is a trend that claims that to balance hormones, increase female fertility, and, for older women, even alleviate menopause symptoms, women should consume seeds such as flaxseed, pumpkin, sesame, and sunflower at different times of the month during the menstrual cycle. Many women with diagnoses like polycystic ovary syndrome, endometriosis, acne, or who suffer from hirsutism, which is facial hair, or have a very sluggish bowel and severe PMS, start seed cycling and report improvements in their symptoms. Some people also notice improvements in their thyroid hormone levels, hair, and a reduction in cellulite, especially after a few months of adopting this diet. So, seed cycling is a natural remedy for balancing estrogen and progesterone levels. When a woman has a regular menstrual cycle, estrogen is produced during the first 14 days of the follicular phase as eggs in the ovaries mature. The levels of hormones like FSH, which stands for follicle-stimulating hormone, and LH, luteinizing hormone, gradually increase before ovulation, and estrogen levels drop after ovulation when the egg is released. The luteal phase begins, and progesterone and estrogen levels rise even more to support conception and the implantation of the embryo in the uterus. These hormones begin to drop if the woman does not get pregnant. Certain health issues can disrupt this normal cycle, including polycystic ovary syndrome, hypothyroidism, and lifestyle factors. Sedentary women may have an irregular cycle, as can women who overexercise or are underweight. Women with excess body fat may also have irregular cycles. And of course, as we age, we naturally produce fewer hormones like estrogen and progesterone, which can cause symptoms during perimenopause, such as hot flashes and weight gain. Proponents of seed cycling say that consuming these seeds, which are rich in phytoestrogens, makes it easier to regulate hormones. Phytoestrogens are natural compounds produced by plants that mimic the action of estrogen in a woman's body. Additionally, some seeds are rich in zinc, like pumpkin seeds, and zinc is important for progesterone production, preparing the woman for a new menstrual cycle during the luteal phase. Lignans, a type of polyphenol found in seeds like flaxseed and sesame, help control excess estrogen. These seeds also have a good amount of vitamin E, which, like sunflower seeds, helps improve progesterone levels. So seed cycling aims to balance estrogen and progesterone through the action of these compounds: phytoestrogens, zinc, selenium, lignans, and vitamin E. In the first phase of the hormonal cycle, the follicular phase, the dominant hormone is estrogen. Both a lack and excess of estrogen are not ideal. Excess estrogen is known as estrogen dominance, and a lack of it can occur in both perimenopausal women and women with polycystic ovary syndrome. To balance this phase, according to the proponents of seed cycling, women should consume daily 1 tablespoon of flaxseed and 1 tablespoon of shelled pumpkin seeds. The second phase, the luteal phase of the hormonal cycle, begins after ovulation, around the 15th day of the menstrual cycle. During this phase, progesterone is naturally produced to prepare the uterus to receive the embryo. Progesterone also regulates mood, memory, reduces anxiety and bloating, improves calorie burning, regulates thyroid function, acts as a muscle relaxant, reduces menstrual cramps, and improves bowel function. To support this phase, proponents of this method suggest consuming 1 tablespoon of shelled sunflower seeds and 1 tablespoon of sesame seeds. It's ideal to soak these seeds beforehand and then blend them into a juice, shake, mix with beans, soup, yogurt, porridge, or pesto. And what do the studies say? When we consume seeds that contain lignans like sesame seeds and flax seeds, they can help regulate the menstrual cycle and hormone levels, but the effects are relatively weak and have mainly been associated with protective properties against ovarian and uterine cancer, which is already quite significant. Studies conducted with postmenopausal women who consumed about 50 grams of sesame daily for 5 days showed improved production of sex hormones, enhancing vitality and libido. Flax seeds are also associated with slight increases in estrogen, so women with estrogen dominance should not overuse flaxseed. However, women with low estrogen may experience hot flashes, making flaxseed consumption beneficial in such cases. There aren't many studies on seed cycling in relation to fertility, but seeds are generally very healthy foods. Including them in your diet is a good way to support gut function, increase fiber intake, and consume more manganese, magnesium, copper, vitamin B1, vitamin E, healthy fats, and even omega-3, which helps reduce cancer risks, lower the risk of heart disease, which increases after menopause, regulate cholesterol, and control blood pressure. Flaxseed consumption has also been associated with better control of blood sugar levels and improved recovery after physical activity. The ideal is to test seed cycling for at least 3 cycles, about 3 months, and see how you feel. However, it's not enough to include seeds in your diet while still consuming hamburgers, fries, and soda every day. We must always think of a healthy lifestyle as a whole, which includes sleeping well, practicing moderate physical activity, reducing stress, and staying hydrated. All of these are important for physical and mental health, fertility, and good mood. Please remember to always consult with your physician or nutritionist before starting any new dietary habit to ensure it aligns with your health needs and conditions. If you enjoyed this video, please like and subscribe.